Hello and welcome to Exceptional Family TV. On this week's episode, we share with you a therapy that works on children of all different diagnoses. It's called ABM, and we start with a journey down to Arizona to tell you about it. Renee and I wanted to try a new therapy for Zachary. Well, new therapy to us, I'm not going to pronounce the name right, it's like Anat-Baniel method, or ABM for short. And one of the practitioners, Michelle Turner, lives in Peoria, Arizona.
It took us 15 and a half hours to get to Arizona. The main reason it takes us a lot longer when we're driving is because Zach has to sit for so long. When we stop at rest stops and things like that, he can't just jump out of the car and run around for a few minutes to get his energy out. We have to kind of do that for him. We run around and sprint and just be silly with him to try to get those 3-year-old jitterbugs out. When we got there, we met Michelle, who was going to be Zach's therapist for the week.
Monday through Friday, 2 sessions a day, 1 hour apiece, and that's called an intensive.
We were really surprised with Zach's reaction to her. He was just willing to go to her, something that doesn't happen with Zachary.
I'm an Anat-Baniel method practitioner. I studied with Anat in California for 2.5 years to do this work. I'm using the skeletal system and the central nervous system to reorganize the brain to work more efficiently. Most of us actually use our muscular system as a skeletal system, and the skeletal system is the only thing that in the central nervous system that affects your brain. I can work with muscle all you want, all day long. It's not going to affect your cognitive function of your brain.
No, there was none.
I know. No.
Sunday he had no twist in his back.
Right.
Monday he does. But see too, what's really important when I do them, he's not holding his breath anymore. And that's
Right.
also a big difference. So that's what softens the chest. That's how much he's learning to move now.
The Anat-Baniel method is different than occupational and physical therapy for a couple of reasons. First of all, we do work the whole system. It's not a passive approach. We work the whole body. It might look very gentle. It's not, again, what's wrong with the system, and it's not about forcing the system. I'm not going to ask him to do anything that he's not prepared to do, and a lot of people feel that's spoiling a child or not letting them live up to potential, but we really have to build the foundations. One of the things I really had to work with Zach is just getting to lie down better. See, this isn't lying down, but when his feet are out, or just like this where he's just chilling out and the legs are off to the side, that's a much more lying down system where he can just shift the pelvis, his knees are up, and he's just content. The head's off to the side. But that translates into sitting, into standing. What the lesson really is Zach's actually learning right now. Zach's doing all the work. So it's actually a lesson in movement, and I'm teaching him how to move. When we first started this week, this tilt of the pelvis wasn't in his system. So once it's there, where he can arch his back and bring his tailbone down. And once I see that, then I can start adding the complexities or the variations, combining the feet in or just letting him move. One of the nice feedbacks with the Anat-Baniel method is just how much it affects the brain function as well as the body. When CP is still a brain function, and so what that means by somewhere in the brain it's telling the arm to do this. If you can show the arm to relax, or whatever the keywords are that people use, we look at it as just organization, but it frees up the brain. Now the brain no longer has that spasticity there, just like he's just chilling out and just eating a lollipop. So maybe if someone's severely disabled and, well, okay, my child will never walk, great, but can they do switches more efficiently? Can we work with the chair? Can we start, where can we make the child more independent with what there is to work with versus looking at limits?
What was also neat about Michelle is that she has 2 children with special needs herself. And so she understands the families coming in with their children, and she works on her own children too. That's why she learned the therapy.
My second son, Graham, who had severe regression at 13 months and got very sick and wasn't diagnosed until he was 4 with Haemophilus influenza. The infection was behind his eyes, so therefore he was hearing impaired and visually impaired through basically all his infant and adolescence. He started off with the Foundation for the Blind, but at the same time, his pediatric gastroenterologist recommended that we go see Anat, and Graham was walking heel to toe within 2 days. He used to walk like a drunk. He could walk, but he'd fall over sideways, backward. He'd one step, down, one step. And he was just walking with his dad just that smoothly. And he's now mainstream. He's actually just started 2nd grade with not even the resource room. So before I started training, his goal was a one-word self-help at 4 years old. He wasn't talking. He couldn't open the door and say open. I don't think they would have done it with any other method. And I wasn't doing any other method. I dropped all my other services except for feeding and speech. I think I just get it because of the autism, because of the visual delays, and that's why I also teamed up doing this work with a vision therapist.
Now you can see it more how his hand's going to the stripe one versus the gray. See, now he's going up towards it.
So she did a session on me so that I could see what she was doing with Zach. It ended up being a very interesting experience, feeling her guide my movements. It's pretty amazing to watch the body with very, very little touch completely relax.
When Michelle gave me a lesson in movement, it was about an hour long, and afterwards I felt like I had just gotten an hour-long deep tissue massage, except Michelle wasn't working me like a massage therapist. It was really a relaxing, soothing experience, and you just felt so much better after it. Now for Zachary, I can only imagine that he was feeling the same thing, especially with his stiff muscles, that while he was getting these 2 hours a day sessions, that was relaxing him and allowing him to feel the right way and the smooth way to move.
Feet, there, your feet, there. You want to do it again? You want to flip over? Say yes. Good job. Yay!
So when you're doing the week intensive is what we really recommend for the kids is to go in, it's 5 days. And we look to change the system from going just a standard progression to a big jump. And then we say go away for a couple of months, which is what I'm going to tell you to go do. Hopefully I'll see you in 2 months. We'll do another week of this, and again, look for the next jump in the system. But at the same time too, if that doesn't work for you, you can do a lesson here or there a day or a week and fit it into your schedule just like you would any other kind of modality. And it should make a big difference in the child system.
The main things I've noticed with Zach since we've done this are his posture, his sitting up. He can sit up for longer periods of time without slouching over. He just seems to be more dead center when he is sitting properly. And also the scissoring of the legs, it seems to be less intense.
The scissoring was very habitual with the legs. Matter of fact, just to even put your hand in, as you know, like this, it was just almost really impossible. You had to force the legs into position, and again, that's something we don't do, is force. Both hands really wanted to be in a fisted position versus having the individual fingers working, which I see much nicer too when he's playing.
We have every intention in trying another intensive with Zachary. One of the things she did tell us was that take about 2 months off and kind of allow the brain to catch up with what you've taught it and have it become a habit.
It's a very productive therapy that you can use with any child. Now some children are going to respond to it better than others, but that's why you should try different therapies and use the ones that work for your own kid.
AnatBanielMethod.com is her website, and actually it's quite extensive, and there you can type in find a practitioner and you can find someone that's possibly local in your area.
Thanks for watching, and be sure to tune in next week as we talk to the creator of something called Project Lifesaver.
It's a program in sheriff's departments across the country and in several other different countries that uses a radio-controlled tracking device on children who tend to wander.